Assalamu alaikum. Now another MSK clinical examination. Suppose Arif 7 years old do the musculoskeletal examination of Arif. So just like the other, wash my hand, introduce myself, taking permission, and then making rapport, and then asking the screening question that I have already asked in other audio recording, and then looking from head to toe what's about his dimension, is there any dysmorphic face, and is there any device present or not, and quick observation, any symmetry of the joint present or not, any tall stature or not, and any what about the skin condition. And after that, just from the gait, will you please walk, and after toe walking, and this gait we are looking for what's about the condition of the lower limb, and then with the back with the permission, and tell the child to touch the floor without bending the knee as per possible. And here if we find that he can touch the floor without bending the knee, so there may be a chance of hypermobility, because Python stone score is 1 here. Then we will go just for the Python scoring of the upper limb. So we will tell Arif, so will you please make your hand, and in the hand we are looking for is there any arachnodactyly present or not, and at the same time we will do the Python scoring for the thumb and the index and the little finger, and bilaterally, and then we will tell that please put your hand just like this, hyperextension of the elbow joint present or not. And if then we will tell the child to lie on the bed, and here we will be looking for the hyperextension of the ankle joint. After getting the bitonis cone, if it is more than 4 out of 9, then it may, and the child is not tall, no sign of arachnodactyly, so we can go for the regional examination, regional general examination. Then sir, as I get Python score is more, so I want to go for the general examination. And general examination, first the pulse, and then in the eye there may be blue sclera, and high arch palate may be present, and in neck we will tell the child to just follow me, and we want to see the neck elasticity, skin elasticity, and then in the chest, chest deformity present or not, pectus excavatum may be found there, and in the heart there may be a murmur due to aortic regurgitation, and then in the para-abdomen examination there may be repair of the inguinal hernia, and lower limb there may be scar, cigarette paper cigarette scar, and this planus is present. So to complete my examination, yes, part we can do, and then we want to I want to do the anthropometry, vital sign, cardiovascular examination, skin scratch test, spirometry, eye examination, formal eye examination, and abdomen examination. So what's it's a case of hypermobility, and my top of diagnosis is Ehlers-Danlos. It may be Marfan, maybe due to familial. So what investigation, how we want to manage the case? For first of all, the investigation, what should be the investigation? Genetic study, and skin test for collagen, collagen, which type of collagen type, and echocardiography for cardiac lesion, and bleeding profile, CGC with coagulation profile, and bone age determination may be needed. And management, for the management I want to take the focus history, I want to go through his previous records, and I want to do the further investigation if needed. And for the management I want to go through the multidisciplinary team, here the pediatric consultant, and orthopedics, orthotics, occupational therapy, physiotherapy, genetics, liaise with school, support group, and I want to give him and cardiologist, pulmonologist if needed, and I want to give him the advice for hypermobility. And so what would be the should be the advice for hypermobility? And the advice are: start with low impact exercise just like swimming or cycling, maintain a healthy diet, wear a supportive shoes, do not overextend your joint beyond because if you can do it, and do not do the repetitive exercise or activities. It take regular breathe and then do the activities. And after that, other theoretical question: what is the type of ehlers-danlos? There is 4 types: hypermobile ehlers-danlos, classical ehlers-danlos, vascular ehlers-danlos, and kyphoscoliotic ehlers-danlos syndrome. And role of physiotherapist: they will exercise, they will advise for the exercise and joint protection techniques, various guided exercise program like postural proprioception and the proprioception and stability and balance training, muscle reduction and stretch training help to improve the joint strength. And role of the pediatrician or orthotics: for special protective splint, brace, tapping during exercise, design the shoes with good arch support, and assist with specific orthotics during the physical activity if there is too much pain or function is affected. And role of occupational therapist: they will help for home modification. And the role of speech and language therapist: there may be swallowing problem in this case. So what we made the problem with hypermobility? The problem of hypermobility or presentation of hypermobility may be arthalgia, difficulty in gripping and delayed walking, and or being clumsy in the early childhood. And thank you. This is all about Ehlers-Danlos syndrome. Thank you. Assalamu alaikum.